Thank you again to all of our panelists, Kim, Darlene, Cari, Brian, and Jody. I'm going to have Brian come back. Thanks. So if anyone has any questions for anyone or all of the panelists, then I invite you to step up to one of the two mics on the side here.
Hi, I'm Jazzy. I have actually quite a lot of questions, but I'm going to limit it probably to just one. So I know that, and thank you, Kim, you presented around the Men's Health Initiative in the interior and gave a bit of a history of it, where its inception was the Engaging Physicians Project. And I think that that really actually came out of the fact that, yeah, the data that was being received was that there's no bedside manner from these folks that are professionals in healthcare providing groundwork. And Darlene, you mirrored that in the work that you've done, that even now, these many years later, that still exists in the communities in the interior. My question, I guess, is then, I mean, from when I was in the interior in the role, I know that Be the Change group had come in and they did this whole, there were a lot of focus groups, and out of this came a whole marketing campaign that was meant to be positioned in doctors' offices. And it was meant to also, part of that initiative was also to educate the doctors so that they could understand what the experience of the patients was. And it doesn't sound to me like that piece of that initiative has actually ever been implemented or came to fruition. I'm curious what efforts are being done, because to me, the stripping of services and testing services is just one side of the coin. The other side of the coin is, well, even whatever does exist, if guys don't feel comfortable with the professionals that are existing there, and they don't feel like they're being, or they feel like they're being stigmatized, they're not going to go anyways. So it's the other side of the coin now that we're dealing with, and I'm wondering, like, how do we navigate this, or are there any efforts being put into navigation of this dilemma?
Right. Thank you, Jazzy, and also thank you again for the work you've done in creating, building some of the foundation for me to do some of my work. One of the projects that Jody was talking about, us doing the lunch, what do we call that, luncheon? The brown bag. Anyway, whatever the interior health has to do the culture and competency over lunch hour was really a great example of us actually breaking into that into the interior health side of thing. And I know that folks I talk interior health say that, there's a big divide between how the health authority operates and how the actual healthcare providers privately operate. And so actually advocating and getting into that, providing the resources, great example. They're made. How do we get them there? And I think my perception is continuing some of the work that we're doing, but hopefully having to advocate that our membership become a bit more vocal and providing and asking their healthcare providers for some of that information and demanding it be put up in their spaces. But I know that's not always possible. So. I know that I want to rebring the engaging physicians, and I've been critiqued by the physicians to actually call it healthcare professionals because not everyone's a doctor, and to incorporate that name to be a broader. And that's on the list of. I now have a folder of like engaging healthcare professionals to re-engage that conversation. I'm really trying to foster the membership, because the biggest thing with this project is the demand is so great for the Men's Health Initiative, and without having membership. Volunteers to drive it and to actually provide some of the services. I'm kind of stuck in this office in Kelowna, and I'm trying to actually operate out of the interior health. And I know you know those challenges, and systematically, a lot of my project is held hostage by the AIDS service organization. I work in the limitations of being positioned an organization that is in demand over responding to the opioid crisis. And it's really a hard challenge to be politically correct to talk about that and say how it's affecting the project, not just in Kelowna, but in the interior health region, for me to be able to do more work like you're suggesting.
Can I ask another question?
Yes?
I think you have to wait. No. Sorry, it's 3:30, so we're actually going into your break already. So,
with with data I saw yesterday, as well as what Cari presented today, I'm kind of blown away by the HIV or the syphilis rates in Alberta and BC are virtually identical as far as how large of a percentage of diagnosed syphilis is amongst gay men. One of the other things that also showed up there was a very similar in new cases of syphilis or cases of syphilis in pos gay men. Now, one of the things I've never seen torn apart in there that I think is important is, are those pos co-diagnosed at the same time as becoming as the syphilis, or is it pos men as part of their regular blood work are being diagnosed with syphilis? Because that's one shows an emergency of who we're not getting at all, and the other shows something different. My perception is that we have in both provinces and probably right across the rest of the country, we have a huge pool of undiagnosed syphilis. And all we're seeing is with the pos men, we get a syphilis test as part of our regular blood work 3 or 4 times a year. So they're kind of canaries in the, in the coal mine sort of thing. We're dipping our dicks and butts into this large pool that I suspect is out there. That other large chunk, those are only the ones that are getting tested. And I don't think anyone can honestly tell me that we're getting as many people tested as we think. I think the number of HIV tests and the number of other STI tests that are reaching gay men, that gay men are doing, is a heck of a lot less than the roughly 50% that Sex Now keeps saying. I think that's a social desirability bias amount. And I think it's that undiagnosed pool, that how do we reach it? How do we do something? I don't know.
Isn't that the million-dollar question? We all want to know how you get to the guys that aren't getting tested.
But the syphilis thing was not, so at least in British Columbia, HIV positive guys, it was not part of their standard blood work until the syphilis epidemic started to rear its head. And it was at that point that the Center for Excellence actually asked docs to build it into their regular blood work. And so even before that, though, we were seeing concentrations of syphilis. In British Columbia, I can't speak for Alberta, but in British Columbia, we were still seeing concentrations of it among positive guys, more so than negative guys. But certainly once we built it into regular blood work, that's why you see a lot of those paired numbers. Now, I don't think it's possible that those fellows could have been dually diagnosed, simply because there are so many syphilis cases and there aren't nearly as many HIV cases, but I bet you there's some overlap, and I mean, yes, there would definitely be some overlap, but that's not what, new HIV infections are not what's driving the syphilis epidemic, or at least we don't believe so.
I thought it was quite interesting that you said they've only very recently included the syphilis test for pos people. I know in Alberta, at least 5 years, if not more, it's been a regular part of my blood work. And I know from one of the presentations yesterday that they're not doing it in Ontario. I mean, our standard guidelines for PrEP are to test 4 times a year, right? Why aren't we taking our one captive audience that we have going in for blood work and testing all the time and expanding it to their entire sexual health? Instead of just syphilis, also get gonorrhea and chlamydia testing as part of regular medical work for our cause people.
I think we have to go to our next question, though, Ian. Sorry.
My name is Jesse Dame. I'm a registered nurse. I have a question, but I'll just make a comment more. I think I've seen throughout the last 2 days, we are very, thing I want to challenge is we're very physician focused, and there's over 56,000 nurses in our province alone, and we need to bring the power back to nurses and empower nurses to be out there to do the testing. I would say there's a registered nurse or an LPN in every single remote community in our entire province. Why aren't we working with the college? Why aren't we working with the Association of Registered Nurses to meet that? We shouldn't be knocking on doctors' doors. We should be knocking on nurses' doors.
That's a good point.
I think we'll end it there. So thank you very much for coming to the session. Thank you again to all of our panelists. We'll give one more round of applause. Thank you. And I think we have a couple of minutes for a break until we have to head out to the final
Jody,
session.
You can ask us your question on the break if you want.